fellow viewers, welcome to this episode on air pollution and its impact on our health. Air pollution has become a major issue in India in the last 25 years or so, and in particular in the last 10 years, it has increased dramatically in some parts of India, particularly North Indian cities. Come November, and everyone in this part of the country, where we are located right now in Delhi, is talking only about pollution and its impact on asthma and health and wheezing and infections. And we tend to think that air pollution means lung problems and nose problems and airway problems. But actually, there is a much greater impact of air pollution on our health. Over the years, research done globally as well as in India has shown that air pollution has far-reaching impact on our not just our overall health, lung-related and others, but also even on our lifespan. So we really need to look at air pollution in a more holistic way. Typically, we say there's a particulate matter. Less than 10 microns is one set, and less than 2.5 is the other. Less than 10 PM is what gets into our lungs and excites all kinds of reactions there, diseases there, which will be discussed. But less than 2.5 has the potential to enter our bloodstream and affect us systemically. This is a bit of an oversimplification, but that's how we look at it. And therefore, we get effects way beyond our lungs. To discuss various aspects of air pollution today, as usual, we have three leading experts representing different fields of expertise with regard to pollution. We're not going to discuss why is there pollution and remedies for that. We're only going to discuss health impact of air pollution. And what can we, as Indians, as individuals, do to keep ourselves safe from this menace that is threatening all of us. We have with us a Professor D. Prabhakaran in the studio, a famous cardiologist and Vice President at the Public Health Foundation of India. We have Dr. Murali Mohan, leading pulmonologist from Bangalore, and Dr. Kalpana Balakrishnan, who is a leading environmental scientist and based at the Sri Ramachandran Medical College in Chennai. So we will start first with Dr. Kalpana, and we'll really be talking about, what is the concept of outdoor air pollution versus indoor air pollution? Because traditionally we think it's all outdoors and our homes are safe. Everything is outdoor air pollution. So what is this outdoor air pollution? The story of the ozone. I spoke only about particulate matter. And then how does it compare and how does it add up with indoor pollution? Can you explain that, Dr. Kalpana?
Yeah, outdoor is commonly referred to as ambient air pollution. Basically, whatever is outside in the ambient environment, in our surroundings, is typically called as outdoor air pollution, and it refers to pollution that is associated primarily with outdoor sources, including transport, power, or any other sources, industries, agricultural waste burning or municipal waste burning, any of the sources that we commonly see outside of our homes end up emitting pollution to the outdoor environment. What is not understood is while the pollution is emitted outdoors, if people are indoors, they could breathe it indoors as well. So an outdoor source can be responsible for considerable pollution of the indoor environments, especially in countries like India, wherein we do not have tightly insulated indoor environments. In addition to that, of course, we can have indoor sources. In the urban environments, the indoor sources are very different compared to the rural environments, clearly because our homes are very different. What is inside the home is also quite different between indoors and rural and urban environments. So in the rural areas, the primary source of indoor air pollution is the type of fuel that they use, and often solid fuels, including biomass or charcoal or coal, can be a major source of indoor air pollution. But we now recognize, while in the urban environments, the indoor air pollution is limited to emissions of some kind of toxic substances associated with the use of particular furniture polishes or other kinds of wall paints and things like that. The indoor emissions in the urban environments too can be quite harmful. But primarily in a country like India, when we say ambient or outdoor air pollution, we think urban environments, and indoor or household air pollution, we think of rural environments. And I want to just clarify that what is outdoors in the urban environment can come indoors, and what is indoors in the rural environment can come outdoors.
So that's a very interesting point, Dr. Kalpana. That's a really interesting way of explaining it, that in urban India, as we all face this, there is ambient air pollution on the outside, and that, as we know, that is also because of excessive production of ozone at this level, whereas ozone layer is important to protect us higher up, but at the ground level, we do have these chemicals that we release from various processes that give rise to high ambient air pollution, which is the major problem in cities. And often the indoor air pollution that we see in cities is also linked to the air being sort of the same inside and outside because of the insulation not being perfect. And therefore, we do get indoor air pollution in cities also. But the household pollution that you see in rural areas is different, which is largely linked to the fuel that is used inside the house. And that gives rise to a higher degree of pollution inside the house than when you go outside. I think those are really, really important points. Thank you very much. I will now move to Dr. Murali, and we will talk about the most obvious impact of air pollution, which everyone understands, and that's on the respiratory tract. That's on our breathing tree, on our nose, our bronchi, as we call them, and the lungs themselves. What is the impact of air pollution on these important areas of the human body?
So these are irritants and they're poisons. I mean, that's the simplest way of putting it. Immediately, these pollutants, which are either the particulate matter or various gases like ozone, as you mentioned, nitrogen dioxide, sulfur dioxide, these are basically the ones that cause the irritation. It's no secret that nitrogen dioxide and sulfur dioxide link up with the ambient moisture to produce acids. Okay, so these are acidic in their nature. And when they enter the system, they obviously immediately cause irritation. But they have longer term effects on the respiratory system. And two things that happen. One, of course, is in children. The growing child's growing respiratory tract gets affected. But also in the adult, the immediate response of the lungs is to tighten up. So people with asthma, for example, are much more vulnerable when they are faced with these pollutants. People who already have sustained lung damage, something called COPD, due to either smoke, self-inflicted tobacco smoke, or pollution-related or workplace-related, already have lung damage, they can get even worse attacks when they're exposed to these pollutants. So we're talking about exacerbations of asthma and exacerbations of this condition called COPD, worse symptoms, increasing cough, increasing breathlessness, and often the need to get admitted to hospital. And practically everybody who has attacks of COPD has a big, big impact on their life, not only then, but also their health in the future.
So we're talking of irritants and the reactions that they produce. What about infections? Lung infections are also impacted by ambient air pollution. You want to make
Absolutely.
a comment on that?
Absolutely. So when you look at the effect of these particulate matter especially, they have an inhibitory effect on the immune system. So your local immune system within the lungs, within the airways, doesn't work as well. So you're more susceptible to infections. It causes local damage. So pneumonias, for example, are a prime problem in patients who get exposed to large amounts of pollutants. And when you're talking about people with asthma and COPD, pollution triggers off these exacerbations, which are partly infective, partly chemical. It increases the risk of getting infections, including viral infections. And you know, the last 2 years, we've been going through this horrible COVID crisis. The risk of getting infections is also higher. It's thought that the virus particles attach themselves to the PM2.5, are carried inside the lung, and not only are they a good nidus, a good seed on which the virus can attach itself, but the PM2.5 also reduces the immunity locally within the lung. So you're absolutely right. Infections and other causes of exacerbation, asthma and COPD are caused by pollution.
We'll now ask Dr. Kalpana again. I'm aware of your work on childhood asthma and environmental pollution. Would you like to make a comment on childhood asthma, the impact of pollution on childhood asthma? And because our children are facing this quite a lot in the cities, but also, as you said, in the villages in a different way. Would you like to throw some light on that?
Indeed. Yeah, so as you can recognize, children spend their time in the cities and in the rural areas, if they are of a particular age group, between anywhere greater than 3 years old, they are going to spend most of their time in the outdoor environment. And in both the urban and the rural environment, the outdoor environment can be pretty, highly polluted, except for some of the cleanest cities and the cleanest villages. But the contrary to what we normally think, the ambient outdoors in the villages often, is not clean enough for these children to be actually breathing clean air. And of course, whenever you're talking about a health impact in children, it is not only when they are 3 years old, but it is about pollution that they experienced while in utero, while they were still, being born by their mothers. So early life exposures, all the way from early pregnancy to early childhood exposures, can really impact children's lung function as well as lung growth and development. And so what we are observing is even children in so-called clean cities often are at risk, increased risk of asthma. They have experienced exposures, early life and throughout their life, all the way up to the years that influence lung development. And what we have been able to document is that there are direct pathways in which children's asthma is exacerbated. So, for example, today in Delhi, you might have a day of about 200 plus of PM2.5, and you're already an asthmatic child. You can have far greater number of asthma exacerbations during the period that the particulate matter remains elevated. But you can also be at risk because early life your exposures have continued to be high, and therefore your lung development has been compromised, and thus increased number of asthma exacerbations. Even if the pollution is not very high, is also not uncommon.
So very valuable information there, a very, very novel and valuable information for us to understand that it's not just because children are exposed like adults and childhood asthma will get aggravated and the risk of getting infections is higher, but especially the asthma when they play outside or in a home environment also they may not get relief because of high indoor pollution. And on top of that, their very development of their lungs or exposure to to excess pollutants in utero when the mother is pregnant or immediately after birth can have an impact on lung development per se. So I think that's really important, and that kind of impact can make them more prone to asthma and asthma-like disorder later in life. And I think that's very, very important for us to understand the wide-ranging impact of air pollution on pulmonary health of newborns, children, adolescent, adults, and the elderly. We'll move away from the lungs for a bit, and we'll come to our friend Dr. Prabhakaran, who's with me in the studio, and who has done pioneering work on the non-pulmonary aspects of impact of pollution, and in particular with regard to the heart, with regard to hypertension. You want to explain to us, Dr. Prabhakaran, the impact of air pollution on the heart, on blood pressure, with particular reference to data about India?
Right. Thank you, Dr. MITHAL, for having me in your studio. So, the general thinking is that air pollution, as you rightly pointed out, causes lung diseases, and a lot of people know about the lungs, but in fact, it affects the heart as much as what it does to the lung, because the small PM2.5 particles enters the blood. Once it enters the blood, it stiffens the arteries. The arteries are the tubes which supply blood to various parts of the body. It stiffens them and therefore increases the blood pressure. In addition, it acts as an inflammatory.
So what you are saying is that the PM2.5, as I was explaining, they enter the blood and they actually have a direct impact on arteries.
Arteries, yeah, they stiffen because there is a cellular lining on the arteries.
Yes.
They damage them
Yes.
and they make them stiff. Once they make them stiff, the blood pressure increases. I'll just put one thing in perspective. A lot of people in India say, oh, we have high propensity to develop heart disease, hypertension, diabetes, etc., because we are genetically prone. Now, you take the example of what bad genes would cause. In an individual, it will increase the blood pressure by 2 millimeters or so. So, that person who has a bad gene will have a blood pressure which is 2 millimeters higher than the average. In the city of Delhi, when we have on an average PM2.5 up to 100, and where we are expecting by WHO standards to be less than 10, now it's actually less than 5, and by our national air quality standards to be less than 40. So let us say if we just reduce by 25, what happens? Every 25 microgram increase in PM2.5 increases the blood pressure by 3 to 5 millimeters mercury more than what your bad genes would cause.
So it's in the environment, really in the environment.
You just reduce it by 25, you'll reduce the blood pressure by 3 to 5. You bring it to the national standards, your blood pressure would decrease by 10 millimeters, which means the occurrence of new hypertension in the community, in the city of Delhi, for example, can be reduced by 15%. Right now it's around 40%. It can be reduced by 15% to 25% if we bring the air quality to the national air quality standards. Right now it's on an average of 100, you get it down to 40, the prevalence of hypertension would come down to 25%. That's the power of combating air pollution for hypertension. Of course, there are other direct effects on the heart. It can cause irregularities of the heartbeat, what we call as arrhythmias. It can cause heart failure. Diabetes can impact the heart and cause other problems. So various organs also can get affected because of diabetes. You know best, and you can tell about in a better way.
Thank you, Dr. Prabhakaran, and we'll take a short break and be back with much more and interesting information for you. Welcome back, and we'll continue the discussion about non-pulmonary effects of air pollution. And as Dr. Prabhakaran pointed out, there's a direct impact on hypertension as a good example, and hypertension as a risk factor for heart disease. So I mean, it's unbelievable to comprehend actually sometimes that a 40% prevalence of hypertension could come down to 25% prevalence if we were really able to get our act in order about air pollution. And similarly, we talk about diabetes. There are close to 80 million people with diabetes in India. And we've always discussed on this program and in so many other forums that is related to our gain in weight, it's related to our bad food, it's related to lack of exercise. All those are correct. But when you look at the risk factors, a recent risk factor in that is also air pollution. It is thought that maybe in different studies show different figures, but one large study, for example, showed that 18% of the new cases of diabetes can actually be linked to air pollution. So what we are saying is that we are getting hit in all ways. Our population is highly vulnerable to diabetes, not because of the genes that we carry, but because of our lifestyle, because of our diet, because of our lack of exercise, because of our stress, because of our sleep patterns, but also because of the air we breathe. The same thing, the PM 2.5 will enter our blood, and in different ways it can impact our body organs, it can increase our insulin resistance, as well as impact probably insulin secretion also. So when you look at this, when air pollution increases, the risk of diabetes also increases. The risk of pre-diabetes, having little higher blood glucose tending towards diabetes, increases. And when you have diabetes, when you are diagnosed with diabetes, air pollution increases the risk of complications. So through the time course of diabetes, look at that, the risk of pre-diabetes and diabetes will increase, the risk of pre-diabetes converting to diabetes will increase, and the risk of a person with diabetes getting complications also increases, all on the basis of air pollution. Such is the impact of this particulate matter. So we need to look at it in a much more holistic way and understand the urgency for correcting and air pollution and protecting ourselves from its impact to save our body organs from damage. I'll come back to you, Dr. Murali, and we'll talk about lung cancer, a dreaded word, but we all know that smoking has an impact. Smoking has an impact on all the conditions you mentioned, on asthma, on chronic obstructive lung disease, as we call it, and infections of the lung. Where does lung cancer feature in the story of air pollution?
So there is a very definite link demonstrated between lung cancer and air pollution. We've been noticing an increase in the level of lung cancers, the prevalence of lung cancers in our country. And a lot of this increase actually happens among non-smokers. We're seeing a lot of women, for example, with lung cancer, and these are primary lung cancers that develop in the lung rather than spreading into the lung from elsewhere. And none of these women, for example, or most of them have not been smokers. Smoking, of course, is an important preventable cause of lung cancer. But here we have a lot of people, and if you look at the numbers, studies show that an increase in the PM 2.5 of just 10 micrograms per meter cube increases the risk of lung cancer by about 9%. If you look at the large numbers that we have in our country, this represents a huge increase in the population. So it's not surprising that with rising levels of air pollution, we have rising levels of lung cancer, and a lot of these are in the non-smoking population. It's a particular kind of lung cancer called an adenocarcinoma that seems to be more common among the non-smoking population. And this, while it is partly genetic, like the other conditions we've mentioned, is also triggered off mostly by other things like pollution and adulterants.
So is it fair to say that living in a highly polluted environment that sometimes we have to makes you a smoker even without the joy of having a cigarette?
That's partly true, but obviously the double whammy of having cigarettes, smoke, and dragging in the polluted air through your lungs and through the cigarettes is going to cause greater damage.
So there is actually no joy in smoking. It's something that we should all try and give up if we have picked up that habit, and try and encourage our youngsters to stay away from it, because it's something that just sticks with you and is going to damage every part of your body. And you can see, and on top of that, we are living sometimes in air, breathing air, which is already polluted. So you can imagine, as Dr. Murali explained, it's a double whammy. So don't get tempted by smoking. Younger people watching this program, it's very important, because that's how things start. You try one cigarette and another, and then you slowly get addicted, becomes a habit. Everyone says, no, I'm not addicted, I can give it up. But it's a big challenge. But I think nip it in the bud. Just don't go down the path of smoking to save yourself and your body from long-term damage. There's a lot of other things about air pollution. We spoke about lungs, obviously. We spoke about heart and high blood pressure. We spoke about diabetes. What are the other areas that are impacted by air pollution?
Right. I think when we talk about air pollution and health, it's like climbing a mountain. So we are somewhere halfway up there. So we need to understand there are several other impacts. Number one, for example, we have studied in terms of total mortality, the total deaths. Is it increased by air pollution in the city of Delhi? Between 2010 to 2016, what we call as non-accidental mortality was higher by around 20,000 in Delhi, and that was attributed to air pollution.
So which means that what I was saying about lifespan or longevity actually does apply here.
Yes, the lifespan is reduced by around 2 years. This is the estimation, so it has to be proven. The second point that I want to make is there are some links that have been established in terms of higher propensity to develop diseases like Parkinsonism, dementia, Alzheimer's. So these are studies from the West. We do not have many studies from India, and we need to show that relationship. That's
so you're saying neurological conditions like Parkinson's disease?
Yes.
So they are also being linked to
air pollution. Yeah.
So again, as you can see, it keeps getting more and more dismal in terms of the impact of air pollution on our health, and I think it's important that we pay attention to those facts. Another area in the endocrine domain is the area of vitamin D.
Yes.
Now, we've spoken on this program a lot about vitamin D and its impact on human health. We know that vitamin D is essential to absorb calcium from our diet, and subsequently for the calcium to reach our bones. If vitamin D is deficient, calcium will not reach our bones, right? So, but we also know that in urban India, vitamin D deficiency, particularly in the north, is quite common. And we often get levels which are totally unacceptable globally, the kind of blood levels of vitamin D that we see. And when we initially presented our work on vitamin D more than 20 years ago, one thing that everyone said was, how can India have D deficiency? There is so much sunlight. India is a land of sun. We all worship the sun. But unfortunately, over the years, air pollution has obstructed the rays of the sun. So basically it forms like a shield, like a barrier. So the sun is doing its job as it's done for millions of years. It's releasing its rays into the atmosphere. We are here on the surface of the earth waiting for the rays to reach us. But in between, the pollution just scatters everything. So we know that it is the sun rays that when they strike our skin, the UV beta rays, they initiate the cycle of vitamin D synthesis. And the absence of UV rays hitting our skin, normally, we would not be able to make vitamin D because there's very little in our diet, hardly any vitamin D in the diet. Now, if this pollution is coming in the way, impeding the path of sun rays and not allowing them to hit our skin, we won't make vitamin D, and that's exactly what happens. In a recent study done by General Marwa and colleagues in Delhi schools, they found that in prepubertal children, even when they gave vitamin D externally in very small amounts, they were just able to reduce the drop that happens in winter. Why are vitamin D levels lower in winter? in the north, particularly because of the angle of the sun and earth, the zenith angle. We won't talk about that. But also because pollution goes up in the winter. And because of this air pollution, we cannot, our skin does not get the right kind of UV ray exposure, and we don't make vitamin D. So, therefore, fortification of food products, milk in particular with vitamin D, as is being planned and being implemented by our authorities, is very, very important. It's an important strategy, especially during winter, to reduce the reduction, to attenuate the reduction in vitamin D level that happens consistently across studies in winter, particularly in the north and in the cities. So I think that's important. And for those of you who are not using fortified food or milk and live in heavily polluted environments in the winter, there is nothing wrong in taking low dose vitamin D supplementation, maybe 1,000 to 2,000 units a day. But that, of course, you have to ask your doctor. I'm just making a general statement. But not overdose yourself. But low doses of vitamin D are probably important for every Indian during winter. And I think that's a very important point. We'll go back to Dr. Kalpana. I think I'd like to discuss a little more about the impact of air pollution on pregnant women. You did describe that exposure to particulate matter during pregnancy does have an impact on development of the lung of the baby. But is there more? Is it associated with adverse pregnancy outcomes in any way? What does air pollution do to a pregnant woman?
Yeah, indeed, the effect on the lung is all but one of multiple things that air pollution can do in utero. It is a composite of multiple organ systems, and in general fetal growth and development that we quite don't understand the exact mechanisms for right now. Is it because of some pollutants being able to cause hypoxia or lower oxygen levels to the developing fetus is why the fetal growth and development is impacted? Or is it because of inflammation? We haven't unraveled the exact mechanism, but what we do know that increased levels of air pollution, both ambient as well as household air pollution, have now been shown to be associated with lower birth weight, greater incidence of preterm births, higher neonatal mortality. So it's a sort of a sequelae. So the adverse pregnancy outcomes, the evidence, including from studies in India that ICMR has supported in cohort studies, has shown very conclusively that low birth weight, at the population level, normally when we, Dr. Prabhakaran was mentioning about, a couple of millimeters of mercury change or a few millimeters of mercury change, a normal practicing clinician, because at the individual level, it might be a very small non-clinical change. But if you look at the population level, whether it is for blood pressure or it is for birth weight, the typical impact for birth weight in India has ranged anywhere between 4 to 20 grams per 10 microgram change in PM2.5. And so if you can look at, polluted cities or people using polluting fuels, this can be up to 100 gram change, in the birth weight. And in a population where the low birth weight prevalence on the average is about 15 to 25%, you can imagine, if there was 100 gram change on the average for people living in polluted cities or people dependent on polluting fuels, the entire distribution can be very much, impacted by this exposure to air pollution. So up to 100 gram change can be expected to be resulting from exposure to air pollution under typical conditions that prevail in our cities and in our villages. But most importantly, I want to sort of pick up on what other impacts have been sort of not so actively pursued in India. And this includes the sequelae from the low birth weight related to child growth, physical growth, child development, including neurodevelopment. So the life course of health impacts is really the most worrisome aspect about the impacts of air pollution from in utero exposures.
Thank you.
So low weight can be responsible for a lot of adult conditions.
Thank you. Really important points, I think. Very important points. Thank you. I think all viewers are learning lots of new things about the impact of air pollution. Having discussed that, we're going to take a break and then come back with some answers as to what can we do to help ourselves. Welcome back, and now we'll try and pick the brain of our experts and try and see what we can do to help ourselves while we do have to live in this environment. Correcting it is really not directly in our hands, although all of us as individuals can make contributions to preserving the environment, but that's beyond the scope of today's discussion. Dr. Murali, what do you tell your patients? Patients who have lung problems, and that pollution increases in particular times of the year, and at those times, they always, fall prey to infections or aggravation of asthma and others. What is your advice to your patients? If I was your patient, what would you tell me? Well, winter's approaching and pollution is going to increase. How would you expect me to protect myself?
So I think one of the valuable lessons we've learned from COVID-19 is that it's possible to protect yourself. We have had far fewer respiratory infections in our vulnerable population in the last 2 years. And this is some group we were really frightened about. What if my patients with COPD or asthma gets COVID-19? What will happen to them? And really, they've taken very good care of themselves. Fear of COVID drove them to stay indoors more often, to stay away from crowded places, use masks, hand sanitize regularly, maintain physical distance, something that's been repeatedly spoken about in the last 2 years and has had an impact not just on COVID-19, but on all other respiratory infections. So that's one important piece of advice I'd give patients regarding keeping, safe during this time. It works for infections, it works for pollution too. Remember that pollution is not going to have an impact on you just from what you inhale, but on other surfaces also. The second important thing is, of course, on an individual level, is apart from looking after yourself, which includes the very important point you made about vitamin D. Vitamin D deficiency, which is ubiquitous, not only impacts your life in terms of bones and minerals, but also in terms of infection. So a low vitamin D level predisposes people to infections. We've learned that again over the last couple of decades. So adequate diet, vitamin D, vitamin E, have been shown to mitigate some of these effects of air pollution and other forms of pollutants. And the third, of course, is what you can do for others as part of your responsibility as a citizen to your fellow human beings. And that is, of course, stop polluting the environment. One of the things that always strikes me as being most tragic is when I walk by our parks and see leaves being burnt, for example, in parks. And that is something that's easily preventable. Don't burn trash, don't burn leaves and other vegetation in parks, both in an individual level, and lobby for it to be removed from your community level. Try and reduce, pollution using your vehicle or car. I see people, even with long wait times at traffic lights, keeping their car on when they should be switching it off. A halt more than variously said as 75 seconds most people would agree somewhere between 50 and 75 seconds, is actually harmful to the environment to keep your car on, keep it running. So it's much better to switch off at such times. Anything less than that, probably the effort of starting the car increases the amount of exhaust produced. But if it's going to be a long wait, please switch off your car. Don't keep racing it periodically. And finally, of course, consider if you can carpool. Not all cities have the benefits that some cities have an excellent metro system. Bangalore is getting it. I know Delhi's pollution levels did get helped a bit since after the metro came, as has Calcutta's. So use public transport where possible, less polluting public transport where possible. But when you have to use your own, which is sometimes inevitable, try and carpool and reduce the number of vehicles that appear on the roads. So these are some of the contributions we can make on an individual level, but also some ways in which we can look after our own health and protect ourselves from the harmful effects of air pollution.
Thank you for those points. And I'm going to shoot some rapid-fire questions at Dr. Prabhakaran, and we'll have others pitch in if they want to add anything. What do you think is the role of masks in all this? I mean, you know, COVID-19 has introduced every Indian to the concept of masks. Masks are not part of our culture. Some countries are used to wearing masks. So do masks have a role to play in this? I mean, should we be wearing masks at a certain level of air pollution?
I'll come back to the masks. I mean, I'll answer the mask, but there are other important things which we can use to address the air pollution. Masks are important when PM 2.5 levels are very high, particularly to the vulnerable sections of the society, which Dr. Mohan touched upon. The N95 masks can actually filter out 95% of the PM 2.5, and therefore they are useful, particularly somebody who's prone to get exacerbations of asthma or chronic obstructive lung disease, people with heart failure, and so on and so forth. They require to use masks.
So it is important to consider use of masks in a non-COVID environment also, which we hope will happen in 2022 at some point, that we will be perhaps sort of rid of COVID. But even then, as so many of my East Asian friends do, that they wear, those who are prone to respiratory disorders don't hesitate to wear masks when they are out. So you do think that's a good idea for us. So people need to get used to the concept.
Right. On a given bad day, they have to use it. Right.
Great.
Now, I was going to talk about three important things which was touched upon by Dr. Kalpana, Balakrishnan and Dr. Murali Mohan. I think they made an important point that the interventions for air pollution has to be across the lifespan. So we say primordial prevention. Even before the child is born, we have to prevent the bad effects of air pollution, and it lies at the realm of policy, be it using clean fuel, renewable energy, increasing the greenery, improving public transport, using low-cost solution to restructure built environment. All these are important, and regulating construction activities, reducing anthropogenic dust. All of these are important and are at the realm of policy. But I just want to talk about, as a healthcare person, I want to talk about two things in healthcare. The health sector itself contributes to around 4.4 to 5% of the pollution in the country. And that can be done by using what is called as sustainable procurement of health equipments, drugs, disposal, using, proper disposal of human waste.
Hospital-based disposal is very important.
So all those things, that's number one. Second is what we call a secondary prevention. For people who have developed disease, people who have coronary artery disease or heart failure, for example, heart failure people are the most vulnerable population because there's a very high risk of dying within 3 years. And one of the things that we are looking at with our colleagues from All India Institute of Medical Sciences, Delhi, Sri Chitra in Trivandrum and DMC in Ludhiana, is to do a trial of low-cost air purifiers to see if it improves quality of life as well as improves survival. And I think we'll get the results in 2 years or so. So those are the kind of simple experiments that needs to be done. And those are very practical things which we can advise
direct
patients.
Impact on human health.
It reduces hospitalization. If it reduces 2 hospitalization, you save a lot of money. And an air purifier, low-cost air purifier will be around 5,000–6,000 rupees.
So does everyone here in the panel believe in air purifiers? Because that's a question patients ask all the time, public asks all the time. Do you believe, of course, you're doing research on that.
I would say that I have what I call as equipoise. I am not sure about it, but the trial will provide the answer.
So does anyone have a comment on air purifiers? Dr. Murali, you would like to comment? Are you recommending air purifiers to your patients?
So definitely for my high-risk patients, my personal experience is it certainly has reduced the level of allergies at home after we installed an air purifier. Does it have solid evidence? No, I don't think it yet has solid evidence. We have evidence with the high-efficiency particulate filters, but not with the standard commercially available air filters. But there are two things to it. One is the cost. The other is, of course, does it have any bad effects? It doesn't have any bad effects. It may help at this point in time. We're awaiting evidence. And yes, for my highly vulnerable patients, I do recommend air purifiers.
Great. So do you tell your patients they shouldn't go out at all during on a heavily polluted day or in a period of several days? Or do you say, well, maybe if you do, then don't go out at a particular time of the day? Is there any preference you have in that advice? Dr. Murali?
So if it's for me, yes, I do tell my patients to avoid going out at highly polluted parts of the day. Important not, for example, to jog during these highly polluted timings. Exercise is good, but levels of high intensity exercise in a polluted environment can cause more problems rather than giving benefit. So I'm not saying don't exercise. I'm saying choose your place of exercise properly. If you have to go out, for example, we just discussed, use a mask and go out. Okay, so you can be sensible. One of the nice things now is we have plenty of information about the level of pollution, and it's not across the city as it used to be earlier. Now, at least in the larger cities, we have multiple tracking stations which can tell you where the pollution is. I've just been receiving a letter from a friend of mine who is developing a personal air quality sampling piece that I'm hoping will help them decide, which are these areas, what are the times that their personal journeys take them into highly polluted and non-polluted areas. So these are some of the things that are increasingly becoming available and which you can use for patients to take individual decisions or persons to take individual decisions on when to go out, where to go out, and what level of activity to indulge in.
So the importance of customizing, of making appropriate choices at an individual level is very important. The fact that very often in the morning, early morning, which is a typical time for morning walks, the pollution levels are very high. And therefore, it is often recommended that you go later in the day when the sun is out and there's a little reduction in the PM, this thing. So I think that's I suppose that's common sense, but it's still very, very important to emphasize those points. But as someone who deals with chronic disorders like diabetes and blood pressure and others, it's very important not to stop exercising. You have to then carry on your exercise at home, whichever exercise you like, whatever is comfortable. You have so many systems of exercising at home. You can practice yoga. Nothing better than that. If you like aerobics, you like the treadmill, you like static cycling. There are numerous apps which can now guide you. You have coaches who can remotely advise you how to continue your physical activity. So don't, for the sake of pollution, completely stop physical activity, because that's going to impact your health in a different way in the long run, especially your blood glucose, your heart, your blood pressure, all those will be adversely impacted. We are running out of time completely. I'll leave one last comment to Dr. Prabhakaran and then we'll close with that. Any comment that you'd like to make to conclude this session?
I just want to quote the celebrated UK epidemiologist Sir Geoffrey Rose. He said, sick individuals come from sick populations. Social determinants like air pollution makes the population sick. So we need to make the population healthy. So we need to mitigate air pollution. But we also need to tackle these sick individuals because who have acquired diseases, and we require to look at it in a very innovative way and manage them.
Thank you all experts for a wonderful, wonderful discussion. We all realize that air pollution has impacted our health in a big way. More and more research has come in which shows that its effects are way beyond the lungs and the respiratory tract alone. It can impact diabetes, it can impact the heart, high blood pressure, maybe some neurological conditions, cancers. So many situations can be linked to this. It can even impact pregnant women, and the outcomes of pregnancy may be worse, and it can impact the unborn child also. So I think those are very, very important areas that we have covered today. Also, what we can do for our personal protection, getting used to masks while living in this polluted environment is important. It's important that we do use air purifiers, but it's still an area which is under research. Overall, using our common sense, using data on air pollution to decide when to go out, where to go out is very important. And of course, very, very important, and the most important actually, is in our way contributing to reduction in air pollution. Reduction in air pollution is to be contributed to by every individual. We love to blame everything on the larger system, which obviously also has to correct itself. But we have to, as individuals, make sure that we are not contributing to pollution in the environment in any way whatsoever. Thank you very much.